Hi, I'm Ozgur and this is Hussain, and we're going to talk about the treatment and rehabilitation of the Achilles tendon.
The Achilles tendon, yeah. Achilles tendon is basically, it's located behind and above above the heel, and it's underneath the calf muscle. And its function is to hold the calf muscle and the heel in place.
There are many causes of an Achilles tendon to have a rupture, and the main cause is if there's too much force or pressure and stress on the Achilles tendon. And this can happen in sports such as football, running, diving, basketball and rugby. It can also happen in usual daily things such as falling down the stairs or even getting a cut in just above the heel. It happens every one person in 5,000 people, and it's usually on people between the ages of 30 and 50. When there's a rupture in the Achilles tendon, there's usually a snap or a sharp pain, but the sharp pain tends to go quickly. However, there can still be some sort of pain in the lower leg. When there's a rupture in the Achilles tendon, the person can't walk properly because the Achilles tendon holds the calf and the heel together, and without the calf muscle being able to work, they can't step on their foot properly, so they'll be stepping on a flat foot, and they also won't be able to step on their tiptoes because they won't be able to bring their heel up because there's no support from the calf muscle. And when there's a rupture in the Achilles tendon, it's recommended to see a doctor as soon as possible because as soon as treated, the better is for rehabilitation.
The immediate responses and treatment for the Achilles tendon. If there's swelling, or bruising, you use an ice pack to reduce the swelling and bruising. And you don't apply pressure onto the injury. You don't move the injury, and you call ambulance immediately. And then once you get taken to the hospital, they'll do X-rays on the injury and to see what's broken, what's happening. And then if the severity is very high, obviously they'll do surgical repair, and it could possibly. It could be required if the injury is very severe, and after the surgical repair, they'll probably put a cast from 6 to 6 months, 6 weeks to 6 months, depending on how severe the injury is.
Once the cast is off, that's when the rehabilitation stages begin, and in the first 3 weeks, the client should do non-weight bearing exercises such as swimming, and they can also do gentle exercises such as spreading their toes and do toe curls. In between the 3rd and the 8th week, they start to increase the weight bearing exercises, and after 6 weeks they can start slight walking, really low intensity, and they can start walking with shoes on after 8 weeks. Between the 8th and the 12th week, they increase the intensity even more, and now they can cycle with shoes on, but not at a high intensity. Between the 3rd and the 6th month, they start doing closed chain exercises, which are squats, calf raises, and exercises like that to increase the strength of the calf muscle and the Achilles tendon. They can also go to the gym and either use a cycling machine or the rowing machine. After 6 months, they can, now that the calf muscle and the Achilles tendon is stronger, they can start doing some jogging, running and jumping. And after 8 to 9 months, they can start getting back to their normal activities with high physical demands. And the other exercises that they can do are towel stretch, which they can use to bend the foot forwards and backwards to increase the mobility of the Achilles tendon and the ankle region. They can stand towards the wall and stretch, which will help stretch the calf muscle because it hasn't been used, it will be quite tight and stiff. The same as the standing cilia stretch is similar to the calf stretch, the standing calf stretch. The step-up machine, the step-up exercise, they can use it to also strengthen the calf muscle as well as increasing mobility. And there are also balance exercises which will help because the leg which has been injured hasn't been used, there will be a loss in balance in that leg. And these are the sets of the bruising.
Okay, thank you. Any questions?
No.
Yeah, Hussain. Alright, okay, thank you.